There are many different types of wounds that can affect the skin. The deeper the wound or the larger the wound, the more problems with complications can occur. The causes of wounds are mainly a problem with blood supply, either arterial delivery of good nutrient blood or the absence of actually good flow of venous blood away from a wound can cause problems with healing and take longer for wounds to get better. If one doesn't take care of a wound, it can get infected. It can become painful and disabling. It can create problems for the patient at work and at home in their everyday activities. When a wound is not responding within 1 to 2 weeks, when it is creating problems with disability, when it is becoming more productive of drainage, particularly that which may suggest infection with redness and malodorousness, and sometimes when we sit around too much and don't move very well, we can wind up getting sores from pressure known as bed sores. They're usually treated by carefully evaluating the whole patient and not just the wound itself, because a wound is not just a function of its own self, it is a function of the patient's general health, which contributes to the wound problem. Understanding that is important so that we can take care of the wound more efficiently. And usually we do this in a wound care environment at the wound care center, and people who have not had experience with wounds may not do as well by it as we can. In the old days, we used to let wounds heal by themselves, dry out. We'd send kids down to the nurse at school when she'd skin your knee, and she'd put mercurochrome or something like that on there, which is a drying agent. We've now found by research that wounds heal better in a moist environment. Well, complications of an untreated wound are often an infection, and if infection gets out of hand and develops infection to the underlying bone, you can develop osteomyelitis. You can lose a limb. You can even lose a life. As we get older, our skin doesn't do us any favors. It starts getting thinner. It loses some of its moisturizing capacity in terms of sweat glands and oil glands, and it becomes more vulnerable to injury from sun. Recovery period for serious wounds is usually about 6 to 12 weeks. It depends upon the size and depth of the wound and the cause of the wound. Sometimes the body's own capacity to heal can't be stimulated by itself, and we have to do other things to push it along more aggressively. And then we bring on things like Apligraf and things that brings in growth factors. We sometimes have to use negative pressure devices. Sometimes we have to do major surgery, such as revascularization or tissue flaps and skin grafting.